I'm speaking today about head trauma and migraine. And here are my disclosures. Now, my objectives are to provide a brief overview of post-traumatic headache, and I'm going to discuss a little bit about its relationship to migraine. We'll be talking about the clinical features of post-traumatic headache, of the mechanisms that may be causing it, and also say a few words about its management. So I'll just start off with this quotation, which is now about 150 years old. And it just points out that even over a century ago, some people realized that even mild head injuries can cause significant symptoms for the patient, which may go on for quite some time. What I'm showing here are the diagnostic criteria for post-traumatic headache, or as they say, persistent headache attributed to traumatic injury to the head. And as you can see, the headache itself may take basically any form, but it's important, of course, that it begin within 7 days of having an injury to the head. And to call it persistent, and this is persistent headache, it must persist for more than 3 months. And finally, there must be no other better diagnosis to explain the person's headache. So I'll just ground us for a moment by going back to a patient. And this is a woman that I saw a few years ago. And she described to me that she'd had headaches since age 10. Now they were throbbing. She had light and sound sensitivity. So I was convinced immediately that she probably had migraine headaches all those years. And they were occurring about 5 days a month. Then 2 years before she saw me, she was involved in what we might call a minor car accident. But since that accident, she had headache on most days of the month with light and sound sensitivity and often nausea. So even though her headaches had really changed since the accident, they still had many migraine features and were in fact somewhat similar to her old headaches, just a lot worse. So leaving the patient for a moment, the question is, how common is headache after a head injury? And this study by Lucas tried to answer that question. They looked at 212 people who were hospitalized after a mild head injury for observation. And they found that 1 year later, just over half reported that they still had a new headache since the trauma, or that an old headache had become worse, as happened in my patient. And also importantly for our discussion today, about half of these people with a headache at a year that was new or worse, their headaches had migraine features. So then the question is, well, of these people who have headache after a head injury, how many have, pretty bad headaches? And they found that of those who had a new or worse headache at 12 months, about a quarter reported at least several headaches per week, and some were daily. So quite a few of these people still had a lot of headache a year after the injury. And also important for our discussion, of those who had these frequent headaches after the injury, over 3/4 had basically a migraine type headache or something that was pretty close to migraine. This graph shows the results. And if you look at the left-hand bar, these are the people with frequent headaches, that's several per week or even daily. The black shows that over 60% in fact had very migraine-like headaches, and another 12 or 13% had so-called probable migraine, which are basically headaches with a lot of migraine features but don't quite meet diagnostic criteria. So migraine was a very prominent thing in the people who had frequent post-traumatic headaches. If you look at the right-hand bar, you'll see that the majority of those people who had very infrequent headaches, but still a new headache or a worse headache after head trauma, most of those people had tension-type headaches. So the bottom line is that of those who had frequent headaches 1 year after head injury, the majority had migraine-like headaches. So then how does head trauma cause headache? And I guess the basic answer is that we don't know, but neuroinflammation may play a role. A closed head injury activates microglial cells in the brain, and these release inflammatory molecules. Even minor head trauma in the lab in experimental animals causes neuroinflammation by activating microglial cells in the brain. There may also be damage to pain modulation systems. These are systems that the brain uses to dampen down incoming pain impulses and reduce pain. And there's evidence that pain modulation is impaired in patients with chronic post-traumatic headache. So there may be a number of mechanisms involved here, and we certainly don't know all of them. Then there's a question of whether people with migraine are more prone to develop persistent post-traumatic headache. Those are long-lasting headaches. And there's been some research on that. This study of 300 patients with post-traumatic headache found that there were several things that made it more likely that a person would develop persistent post-traumatic headache, and these included a history of migraine, and also a history of previous psychological or psychiatric problems also increased your chances of having post-traumatic headache. But the migraine history is there. I'll just mention one more study. This is the Canadian study, which looked at the pediatric age group, looked at over 1,700 patients who presented to the emergency room with a mild acute head injury and had a concussion. And they found that at 28 days, about a third of these patients still had post-concussion symptoms. I'll remind you that the most common post-concussion symptom is headache. So the question is, which patients tended to have these post-concussion symptoms persisting at 28 days, whereas most patients just got better? And they found 4 factors that predispose people to developing or still having post-concussion symptoms at 28 days. And you'll notice that older age group was 1. The teenagers had more symptoms at 28 days than the younger children. Females were more likely to develop these symptoms or still have them at 28 days than males. A prior concussion also kind of set you up for having worse symptoms after a second concussion. But you'll also notice that a physician-diagnosed migraine history is on the list there, and that the people who had a previous history of migraine were more likely to have persistent post-concussion symptoms at 28 days. So I'll close with some words on management. For years now, we've said that if a post-traumatic headache resembles migraine, you treat it as migraine. And I think that's still true today, although we recognize that post-traumatic headache may be somewhat more complicated than the average patient with migraine. They may have other factors related to the trauma, which may be involved in their headaches. For example, they may have a neck injury, which is causing headache. They may have some depression and anxiety, or even post-traumatic stress syndrome related to the trauma, and so on. So things can get complicated after a head injury. In terms of non-pharmacological treatments, psychologists and physiotherapists can certainly be very helpful. Psychologists can address pain coping skills and teach these to patients and help them to manage them. These include things like pacing to keep your activities to a level where they don't trigger your headaches or make them worse through fatigue or stress. Relaxation exercises can be important, to mention just a few of these things. There may be issues related to the trauma, including PTSD, post-traumatic stress disorder, or mood changes that need to be addressed. Physiotherapists can look at the temporomandibular joint and the neck, and also check whole body function to see if there are things that may be contributing to the headache. And for example, if patients have knee issues or shoulder issues related to their injuries, these may in fact also be impacting their quality of life and causing frustration and pain. Pharmacological treatment, well, we need to consider again whether a neck injury may be a contributing factor to the headaches, but also some of the new migraine preventive treatments are showing promise in post-traumatic headache, but more research is needed. For example, there's been a randomized study looking at botulinum toxin type A, which is commonly used now in migraine prevention. And you can see here that over time, this shows the number of headache days per week. The black line are the patients who got the botulinum toxin, and their headache days per week are going down, whereas the placebo, the gray line, doesn't go down nearly as much. So this shows promise for patients with post-traumatic headaches. Then there's also a study looking at the new migraine preventative medications, the CGRP antagonists, the monoclonal antibodies that are now being used more and more in migraine and are basically a migraine-specific kind of treatment. This study found that patients who received erenumab, one of these antibodies, had a reduction in headache days per month. But this study had no placebo group, so it's not really definitive. We need more research, but it's perhaps not surprising that the patients improved because, as you can see, most of the patients had chronic migraine or mixed migraine and tension type headache as their post-traumatic headache form. Other studies with the new antibodies haven't been quite as promising, but whether this works in post-traumatic headache, I think, may depend upon the kind of headache the patient has. If they have a migraine type headaches after trauma, and maybe even a previous history of migraine, these medications may be successful. If they have chronic tension type headaches, then they may not be successful. So back to our patient. She had failed several previous preventative medications, so we gave her erenumab at that time. And you'll see that over the next 3 months, her headaches gradually improved. First, a decrease in pain levels, then a decrease in headache frequency. And by the 3rd month on erenumab, she only had 5 migraine days a month, with each lasting less than a day, whereas before she had headaches virtually every day. So she was successful with this treatment for her post-traumatic headaches. And that was very helpful to her and gratifying to see. So I'll conclude by saying that many patients with mild head injuries recover completely and they recover soon, but a significant proportion can go on to have persistent post-traumatic headache for months or even years. These headaches aren't completely understood, but they may involve neuromodulation and dysfunction of pain modulation systems in the brain. A history of migraine seems to make it more likely that post-traumatic headaches will remain a problem for longer periods of time. The majority of those with more severe or frequent post-traumatic headaches will either have worsening of their previous migraine headaches or will have developed a new migraine-like headache. And several therapies can be helpful, and this treatment, to be successful, may need to involve a multidisciplinary team. And with that, I thank you for your attention, and we'll go on to our next speaker.